President Trump could be released from Walter Reed Medical Center today, where he's being treated for coronavirus. He's been there since Friday. Naomi Ruckham reporting for WJZ from Bethesda.
President Trump thanked the staff of Walter Reed Medical Center in a video tweeted Sunday afternoon.
The nurses, the doctors, everybody here. I've also gotten to meet some of the soldiers and the first responders, and what a group.
The president then took a ride outside to see his supporters. With Secret Service in the car, the drive drew criticism from an attending physician at Walter Reed. They might get sick. They may die. Dr. James Phillips tweeted, "The irresponsibility is astounding."
It's been a very interesting journey. I learned a lot about COVID. I learned it by really going to school. This is the real school. This isn't the let's read the book school.
President Trump has been receiving treatment here since Friday. His physicians say he could be discharged today.
The fact of the matter is that he's doing really well, that he is responding.
The president has been given supplemental oxygen twice. Doctors are treating the 74-year-old with the antiviral drug Remdesivir and dexamethasone, a steroid given to patients with severe cases.
So he still has time to go until I think he's out of the woods.
Former FDA Commissioner Dr. Scott Gottlieb says doctors should be cautious.
Typically what we see is in the first week you have sort of the viral response phase of the infection, and it's that second week when patients sometimes get into trouble.
In a Reuters Ipsos poll, 65% of Americans believe President Trump probably would not have been infected if he had taken the virus more seriously. Naomi Ruckham, CBS News, Bethesda, Maryland.
6:33 now. Over the weekend, we've learned the president was given a second dose of Remdesivir. WJZ is live. Amy Kawada reports how this drug treats patients like President Trump. Amy.
Max, the president has taken the second dose in what's a 5-day course of Remdesivir, and one of the first clinical trials on that medication was conducted right here at the University of Maryland Medical Center.
The president yesterday evening completed his second dose of Remdesivir.
An update on the president's COVID-19 treatment, including a 5-day course of Remdesivir.
He's tolerated that infusion well. We've been monitoring for any potential side effects, and he has had none that we can tell.
The medication was approved by the FDA for emergency use to treat COVID cases. It works by stopping the virus from spreading in the body. Researchers say people on Remdesivir took an average of 11 days to get better versus 15 days and recovered 31% faster. In April, the University of Maryland's Medical Center participated in a clinical trial. Patients and doctors were optimistic.
By the time I left the hospital, I was already improving drastically.
In addition to Remdesivir, the president is also taking dexamethasone, a steroid shown to improve outcomes for patients with COVID. Doctors say the president is making substantial progress since his COVID diagnosis.
Today he feels well. He's been up and around. Our plan for today is to have him to eat and drink, be up out of bed as much as possible, to be mobile.
And again, doctors say if the president's condition continues to improve, he could be discharged from the hospital as early as today. He would then continue his treatment course over at the White House. Live this morning, I'm Amy Kawada for WJZ.